Thanks for joining us. I'm Meera Bains. New rules for masking in healthcare settings go into effect in BC starting next Tuesday. The changes come as the province is set to roll out its public campaign for COVID-19 and flu vaccinations. But as Meera Bains reports, not everyone will have to mask up.
Masks are back, at least in some settings. As of October 3rd, you'll need to mask up in all healthcare settings, and that applies to both healthcare workers and visitors. Places like hospitals and long-term care facilities are on the list. But not all patients and residents are required to mask. That will be a personal choice.
I think most people are reasonable. They understand that when you go to a healthcare setting, that's where people are most at risk. Your loved one may be at risk in those settings, and healthcare workers know that as well.
The province released data showing a concerning trend as the province hits respiratory illness season. COVID hospitalizations are up from summer months. One of the reasons is more global travel, which means viruses are also spreading.
I also acknowledge that this is the first step, and it may come to fruition where we go back to masking in large settings.
There are no new rules for schools. The province will roll out vaccinations after Thanksgiving Day long weekend, with priority groups receiving invitations first. COVID-19 and flu vaccines will be widely available at pharmacies and public health clinics.
Primarily, vaccines will be available quite widely in communities through pharmacies, both the COVID vaccine and the flu vaccine, and we encourage people to get them at the same time, and you'll be able to book the appointments at the same time.
The province is hoping more masking and vaccinations will help reduce the pressure on the healthcare system. The BC Nurses Union says there are already major workload concerns.
We know we're going into RSV season, influenza, COVID. As it stands now, we don't have enough nurses in this province to take care of the demands now.
The province says masks will not be mandated for everyone in healthcare settings for a number of reasons, including the fact that residents of long-term care facilities call them home. Meera Bains, CBC News, Vancouver.
Now we want to dive deeper into what this means for British Columbians. Joining me now is Dr. Iris Gorfinkel, a family physician and founder of Prime Health Research. Doctor, why is this move so significant?
I'm super excited because for once we see a province being proactive about masking. Proactive before hospital systems get overwhelmed, before we don't have enough ICU beds. That's super exciting because the vulnerable and their families can now go to hospital with the confidence that people are doing everything they can to prevent them from getting infected with COVID. And I only hope that this lights the path for other provinces and the territories.
Should this have gone further, though? I mean, some will say, healthcare workers perhaps especially, that they also need protection from patients coming in, but it's not mandatory for patients.
Well, this is true, but understand, the perfect storm is about to happen. We're going into cooler weather, and the COVID actually transmits more easily in cool weather, as does influenza, as do cold viruses like RSV. So for this reason, to protect our limited number of healthcare workers, to protect the vulnerable patients and their families, and never mind, what about the long-term consequences? Sometimes that seems to be falling off the conversation altogether. Long-term complications, and I'm not talking about only long COVID. I'm talking about the risk of heart attacks, the risk of strokes, the risk of long-term lung and heart problems. These all increase. So I'm excited that British Columbia is doing this. And as I mentioned, let's hope that other provinces and the territories follow suit.
So with this being the perfect storm, as you say that we're coming up onto, do you think that this mask requirement will just be a seasonal change?
Well, I think for now, I think we have to play that by ear to see how it goes. Judging from Australia's flu season, they had a flu season very much like last year. But the hospitalizations were no higher than they were in last year. So that's a good thing. But even so, we cannot take anything for granted about what future vaccinations will bring. It is a strong recommendation that people get vaccinated, but understand the vaccines, unfortunately, did not prove to have very long durability. In other words, they didn't last as long as we were hoping they would. So that's a serious problem. So our success will rely on the combination of things we do, the hand washing, the air filtration, of course, masking and vaccinations.
Just quickly before we let you go, masks, it's no secret, are often seen as a political symbol instead of just a health precaution. How do you convince or what do you say to people who really have no desire to wear a mask anymore? A lot of people are tired of that.
I think that hospitals have to remain safe places where people can go because they want to get well. They don't want to pick up an extra disease like COVID, like influenza, like many cold viruses. So that's one aspect to it. But I think the polarization needs to end. We need to agree on what we all value, which is keeping loved ones and vulnerable people safe, keeping the general population safe from long-term complications of COVID-19.
Dr. Iris Gorfinkel, thank you so much for joining us live tonight.
Many thanks for having me.